Hi, everybody. Welcome back to Above the Haze. Eric Postow, managing partner of Hold On Law Partners. With me today, Kenny Watkins of the American Journal of Endocannabinoid Medicine. He is the founder and director of this journal, which he founded in 2019. Kenny, thanks so much for joining me today on Above the Haze.
It's my pleasure. Thanks for having me.
So I want to jump right in. What is the American Journal of Endocannabinoid Medicine?
So it's the American Journal of Endocannabinoid Medicine is a medical journal, and I'm glad you started with this question because it's a great place to start. We're not a cannabis journal. We focus on the endocannabinoid system as a biological target. So anything that engages or interacts with the endocannabinoid system, and as you know, that's many, many, many things. We'll report on it, and we'll report on the positives and negatives as well. We're not cheerleaders for cannabis. We're cheerleaders for science and research. If we're cheerleaders for anything.
So let's just kind of walk through the founding of a journal, a medical journal. Medical journals have research. Medical doctors and researchers put in articles. It's peer reviewed. Is your journal upholding those types of standards?
Yeah, we're a peer reviewed journal. And, especially when we launched, it was really difficult to find novel research because it's really difficult to do research here in America. So we started looking outside of America and started coming up with some great research from Israel and Uruguay. And now Canada's starting to get on board. Australia is about to get on board with producing more research. So it's just great to see all this research is happening all over the world. And I think here in the United States, you're going to see an avalanche of research over the next 3 to 5 years.
Why do you think that is? I mean, what is the endocannabinoid system? Why do we have a journal dedicated to it?
The endocannabinoid system basically keeps everything else in our bodies in balance. So sleep and everything that you eat, it impacts so many of the other different biological systems. And for a long time, we didn't even know it existed. And once we found out it existed, then we had to find out, how do we engage with it? And that's where we learned that we have endocannabinoids, each one of us circulating through our body since birth.
And it's almost like this was this huge system within ourselves that almost appeared out of nowhere. It's been there the whole time, but have we just not been paying attention? Don't the medical schools teach this system? Don't we know what it is?
That's a great point. The medical schools don't teach the endocannabinoid system, and I think it should be taught in high school, right? So, right alongside of the cardiovascular system and the nervous system. It's every bit as important because of the impact it has on all those other systems. So med schools, they're starting to come online, some of them now, but for the most part, med schools aren't teaching physicians about the endocannabinoid system, putting them at a severe disadvantage, especially in the last 3 to 5 years when patients are coming in droves asking the doctor, even if it's for a simple recommendation on what brand of CBD should I buy. These doctors have no idea even what they can say, depending on the state that they're in. So that's a real concern of theirs. And they don't really have the background to talk to the patient. Oftentimes the patient comes into the doctor's office with more information on the endocannabinoid system than the doctor has. So that really turns that doctor-patient relationship on its head.
And was there some kind of event that got you? I know you've got a career in publishing and you're more on the media side of things, but why did you end up with this journal? Why was this important to you?
Yeah, I've been in publishing, as you mentioned, for about 25 years. And I guess it was around 2017, 2018, I started to see the way the medical journals that I grew up with and that I respected, the JAMAs, the New England, the Annals of Internal Medicine, medical journals that I respected, the way they were handling medical cannabis. And, a lot of times when the reporting was even, dare I say, positive, there was always, a caveat. More research is needed. This research is inconclusive. And that's all you need to do with a doctor to sow that seed of doubt in their head. They don't listen to anything else. And for a long time, they didn't need to. They weren't getting a lot of questions from their patients for a long time. And the only thing that they were they were told in medical school was keep your patients away from this. It's a gateway drug. So there was no thirst on the side of the doctor to learn anything more about medical cannabis or the endocannabinoid system. That's all changed. And now doctors they have to be curious because the patient is driving it.
Well, are you seeing that? I mean, since you've come online, and I know you've got through COVID and you've really ramped up post-COVID, what's been the response from the medical community?
The response, since we were since we were acquired by Haymarket, the response has been great because we've been able to kind of have a consistent presence, whether it's LinkedIn or other social media, and we're able to publish on a consistent basis. So we update our website every single day with new content. And the research and the podcasts and the video interviews that we have coming online are really exciting. And I think as we move forward, it's just going to more content, more research, and more people getting involved with the industry from other industries and bringing their know-how into the cannabis industry.
Do you have doctors reaching out and saying, "Hey, this is really great. We'd like to know more about this"?
Yeah, education. I mean, that's the buzzword. And, what you're hearing as far as cannabis and psychedelic medicine too, education. And education comes in a lot of different forms. It's not always a testing module. And a lot of times it's just, reading the latest research that's available on a given subject. And that's kind of what we try to do.
And since you've been doing this and more research has come in, how has your own understanding of the endocannabinoid system evolved?
I feel like I learn a new fact about the ECS every week. If you just go online, there's so much information out there, and that's great, but it's also not so great because you have to vet all that information. There's so much bad and sketchy information online about everything, but specifically about cannabis. And it is medicine, and it is potent, and you really need to know about dosing, and you need to know about drug-drug interactions, and the doctor oftentimes doesn't. And the fastest group of folks engaging with cannabis for their first time are the elderly, our seniors. And these are typically the patients on the most different amounts of medication. So drug-drug interactions is a big deal before a doctor can even consider cannabis for their patient.
Interesting. I wonder then, there's some big news yesterday. About a year ago, the Biden administration, President Biden, had asked Health and Human Services to look into the question of scheduling of cannabis or marijuana as it's under the CSA. And yesterday, HHS recommended a reclassification to Schedule 3 from Schedule 1. Now, Schedule 3, some of the primary differences is that as the potential for abuse is less than substances in Schedule 1 or 2, although it may lead to moderate or low physical dependence or high psychological dependence. Some of the examples could include Tylenol with codeine or some other things. I think testosterone is in there, ketamine, things like that. Is this welcome news to the journal? And to the medical?
Yeah. I'll tell you where we get real excited, a couple different levels, but let's start at research. What's really going to catapult the industry forward, in my opinion, is peer-reviewed science and research. If you want to change a doctor's mind, you have to confront them with peer-reviewed science and research. The case studies are great, and we run them, and I respect them. The anecdotal studies are awesome. But if you really want to make a difference, I think, and have a doctor consider a different way of treatment, that's the way you do it, with peer-reviewed science and research. And I think one of the things that Schedule 3 is going to allow is for the United States to really just open up the faucet as far as research is concerned. And then we don't have to depend on other countries to get this research in. And, we do research the best in the world. So I'm excited to see where this goes just from a research standpoint. And then, of course, that research will lead to products that will ultimately have, a positive effect on patient outcomes. And that's, in a nutshell, that's where I get excited. I get excited at the research and the products that will come from this research.
Is it your opinion that we have only scratched the surface on the potential of the cannabis sativa plant and the medicinal value that it can provide?
Yeah, I feel like I hate to give the count on the amount of cannabinoids that we know about in the plant already. It's like 230 something, but it changes every day. We need to learn about each one of those, major and minor cannabinoids by themselves, and then how they act in the presence of each other, right? And then how they act in the presence of, other plant-based medicine like psilocybin and some of the other things that we're seeing coming online, and then how they act in the presence of, synthetic medicines. And can those cannabinoids be successfully synthesized? These are all the questions that I think are going to be answered and can be answered now because the research is allowed to be done.
I wonder, from a culture perspective, if you were to kind of survey the types of informational news that comes out about cannabis and its effects on people, the majority of the news that cites research is in the negative, as I see it. Is that your take on things? Why do you think that is? And do you think that your journal might lead to more balance out there?
Yeah. So that was one of the things too we noticed, prior to launching, about how so much of the content was negative. And I think you have to look at who's financing the studies. There are so many negative studies out there. Let's do a little digging and see who's behind the studies. And I'm not going to call anybody out right now, but anybody can look and see who's paying for these studies. That might be why there's so many negative studies about cannabis, because there's certain, let's just put the cards on the table. There's certain business sectors that don't want to see cannabis advance for their own purposes, to protect their own profit margins. So yeah, I think a lot of the research that's being financed is negative. And one of the things, my original hopes for Agent was that we could be a platform, right, for all research. And again, positive and negative. Like if there's negative information about cannabis, we're going to put it out there, or psilocybin or MDMA. We're going to publish it.
Yeah, I mean, the informed consumer is the end goal, right?
That's it. And I feel confident that, when you compare cannabinoid treatment versus X or other things that are out there, it's going to perform very well with some patients and certain conditions. It's not a magic bullet. It's not something that's going to work on every condition for everybody. But I absolutely think that it will work for a lot of people in many different conditions, which is really exciting.
Are you a believer that cannabis should have a place solely in medical? What's the feel on the adult use,
So
personal choice side?
my take on this, Eric, is might be a little bit different. I think there's a lot of folks that think they may be recreational or adult users that are actually medical users, right? So what am I talking about? The guy that comes home from work and would typically pour themselves a drink or grab a bottle of pills. Maybe he takes an edible, or maybe she lights up, and you deal with that stress in a more holistic, healthier way. I think a lot of folks that see themselves as, I'm just getting stoned, are actually treating a very real and tangible medical condition. And I think when we take a look at that group, yes, there's definitely a large group that just likes cannabis as a party drug, but that term gets a little convoluted too. How are you using it? Are you using it to sit there and unwind after a hard day? Well, isn't that the same way you would use a lot of other medications?
Yeah, I recently kind of thought about it as like the difference between cannabis and opioids or alcohol or depressants are, with cannabis, it's seemingly more about tuning in rather than tuning out. And I think some of these other adult products or medicines or drugs or whatever really are about numbing the senses and tuning you out to what's going on in your life. Whereas cannabis seems to be more of an opener, kind of that introspection, calming things down, slowing things down. It doesn't work like that for everybody,
Right.
of course. But I almost wonder if, as an alternative to some of these other things, for uh, you said holistic, a holistic view of medicine. Why am I taking a pain medication? Well, I have physical pain. But if I take a medication that not only helps with the physical pain, but allows me to kind of tune into my body and understand my pain and understand my relationship to pain and understand my relationship to the medicine, I might have a better outcome. And have you heard anything like that? Is that something that resonates?
I hear that a lot. I hear that a lot, and I love hearing that, especially from the patient side, who didn't think, maybe that they were using cannabis medically, who, after learning about it, yeah, I kind of am. And here's the reasons why. Unlike an X, it doesn't goon me out the next day, or I'm not blotto when I'm trying to talk to my kids at night. You know, you can ingest cannabis, and listen, you can ingest too much cannabis too. And that's a very real thing that we should put out there and report on. But taken under a doctor's supervision and in the correct dose and in the right delivery system, I think it could be a very effective medicine for so many different ailments.
And medicine is a very distinctive word from drug.
Yes.
Is that a kind of a term of art here? What does medicine mean in this world?
And that's, I'm glad you're zeroing in on this, because there's two big decisions that we made early on, and the first one we already talked about, and that was not to limit ourselves just to cannabis. Let's talk about the entire endocannabinoid system and where receptors are located. Let's really, if we're going to do this right, let's do a deep dive on that. And so that's kind of where we started.
Yeah, it almost feels like, over the last couple thousand years, we in the West in particular have lost our relationship to natural medicines, plant medicines in particular. Indigenous communities have retained a lot of their knowledge and wisdom on different types of plants, in particular plants that are known to be psychedelic. And I'm wondering if what we're really entering is an era of greater awareness around plant medicines and how they can interact with us and our relationship to nature in general, a more holistic view again.
I think you're spot on, and I think we were trending in that direction anyway. And then let's be honest. I think a lot of people's reaction to the vaccines, had people taking, hitting pause and taking a better look at different therapies, right? Um, I think that a lot of folks already had a negative view of the pharmaceutical industry in general. And then when you added the whole vaccine thing on top of it, there was a distrust that exists to this day that I think has really opened up a lane for plant medicine.
Yeah. I think some of the concerns I'm hearing out there on the Schedule 3 is that it's a boon to the pharmaceuticals and not necessarily to the consumers or the advocates.
Yeah, I'm hearing a lot of that too, and it's true. I mean, there are some good people and good companies are going to be negatively impacted by this, no doubt. But and, people were calling me and texting me like I was the head of the FDA. And I'm sure you were getting, like it was my decision. And I think it was a good decision. I think it was a step in the right direction. And I don't think uh, that the perfect should be the enemy of the good, right? Everybody's been clamoring for change for so long, and then change happens, and then oh well, it's not
Well,
enough.
I think what you see is that the business interests of the industry, as it has evolved, are now coming into conflict or perception of conflict with that change. The change that we really don't know what's coming. I think the fear is that if it's Schedule 3, it will be regulated by the FDA differently, and a lot of these businesses will have to go out of business because they won't be able to do it. We really have no way of saying what's going to happen. What I think we're probably entering is an era of legislative change, and that something like this, the reclassification requests from HHS, is actually the push of that boulder down the hill. Because we've all known this for a long time. Those of us who worked in the industry, we knew that there was medical value. We knew that the dependency and the abuse side, while present, was not that extreme, and certainly did not need to be put on the level of heroin and cocaine, which was killing folks. Meanwhile, cannabis has been shown to decrease the dependency on opioids. So we've known this for a long time. So there was a little bit of validation in the request from HHS. I'm also hearing the fear, but I think it's more about the financials rather than the holistic view of like what's the place of plant medicine and cannabis in society.
Hmm. Yeah, I've been hearing a lot of that too. And we get accused of, well, you guys are part of big pharma. We're not pushing away big pharma, that's for sure. And I think a lot of people will be helped. A lot of patients will be helped when big pharma takes a bigger stake in the industry. And I think if it does go that way, big pharma is going to bring the infrastructure that and the regulations that the industry desperately needs. Because the other thing that you've heard about this entire time is, oh, it's the wild, wild west and it's unregulated and we need safe banking. And well, maybe all that happens because of this scheduling change.
Well, I think so. I mean, there's immediate impacts on 280E, the tax burden that's been harming industry folks. We just don't know what's going to happen, but I think the reality is that something needed to happen, and if this is the thing that allows for real change to occur, then I welcome that, and I welcome being a part of the conversation because it's a community that resolves these issues. The community has to come back together and say, well, okay, what do we want to do with this? Right. So the folks on the ground, people, consumers, advocates, ancillary businesses, plant touching, doctors, folks like you need to start saying, legislators, do your job.
Right.
We want reform. We want comprehensive legislation here. We're not afraid of a regulated industry, but we want common sense regulations that doesn't put everyone out of business. And I understand the desire to call something Schedule 3 and still control it that way. But the reality is, for the last decade, we've watched adult use marketplaces behave basically responsibly. And what I mean by that is all of the fears of intoxicated driving or psychosis or all of these things that we've heard for 100 years in the era of prohibition did not come to fruition. We have responsible adult use consumers, we have responsible patients, and we have irresponsible people. And that will always be the case. Yes. And guess what? This is America, Jack. We're supposed to be a free society.
You're right.
We're going to allow for kind of that spectrum of responsible to irresponsible. Make it common sense. Make it make sense. Return the medicine to the people.
100%. And Eric, what I'm hearing is in cities and states where it's been legalized, the amount alcohol abuse drops, dependency on opioids drops.
Yep.
In some instances, crime has dropped.
Yeah.
So I don't think we know enough to say like this is the template that we can apply to the entire country, but it's just interesting to make those observations.
Well, I certainly applaud what you're doing. I'm incredibly interested in the psilocybin and some of the plant medicine psychedelics and their impact on the endocannabinoid system. So I do encourage you all to explore those. I know Johns Hopkins, NYU, and a few other schools have done a lot of great work on that. And the research is actually seemingly more comprehensive than the cannabis.
It's incredible.
Right now. But I'm not sure if I'm seeing the same research with respect to the endocannabinoid system and these other medicines.
It seems like there's a couple of things at work here. I think, and I'm just riffing here. I don't even know if what I'm saying is accurate, but I think the pharmaceutical industry loves psychedelics because it's one molecule and it's easy to synthesize and patent, and it falls very nicely into the existing system. Whereas here comes this plant, this unmanageable magic plant. It doesn't fit into any system. It's got a million different cannabinoids that we have to figure out what they do and how they work. And this is easy. We understand this. So that might have something to do with it too. I don't know.
Totally. Could definitely. Well, please keep up the good work. And Kenny, I'd like you to, if you can, what is the one word that you would use to describe where we're at with respect to cannabis in America?
Hope. I think we're in a very hopeful spot right now. I think, but we're not just hoping one day in 30 years this is going to happen. Things are happening today, and I think we have to be excited and celebrate that, and hopeful for what the future is going to look like. And instead of saying, Schedule 3, we wanted it to be descheduled, so this is no good. I didn't think descheduling was even on the table, to be honest with you. But I'm hearing a lot of people talk about how that was the only path forward. I'm not sure I agree. Maybe it's incremental change that we're going after right here. And this is a great first step, I think.
I'm with you. Kenny Watkins, American Journal of Endocannabinoid Medicine. Thank you so much for being with me today.
Thank you.
Everyone, Eric Postow, Hold On Law Partners. This was Above the Haze.